Would it be helpful if I if I orient everybody to the graphs?
Yes, please. Because the font is quite tiny, so I'm
Mm,
not sure I can read it.
all right, I'll try to like zoom it. All right, so this is baseline. This is simple FCT. This is they go back to baseline again, and then they go to back to simple FCT, and then they moved to intermediate FCT, where they started to shape it towards a more advanced requesting. Especially since two of the kids have pull-out SLP sessions, speech sessions. Um, I thought was really interesting as well. When I was in my first graduate school that is not behavioral based, I took part in one seminar where we talked about this, particular studies where this is in the US. Okay, I know nobody's in the US right now, but at least in the US, a large percentage, I believe about 70% of people who are incarcerated in US jails, they have some sort of language disabilities. And so, I thought this study is pretty fascinating because it is giving teachers as well as practitioners really practical way in which to do a real intervention as to not have that school to prison pipeline process continuing, because these kids, they might not have the speech skill or the social skills in order to ask for a break appropriately, and so the FCT, I thought, was a really, really important part of the intervention. um Sorry, continue. And this is terminal FCT, where they started to have to teach the child more complicated manding for a break. And then this is tolerance response training, where the child needs to say okay when his request for a break is being denied. And then this is a terminal FCT, where the child, they go back to terminal FCT after the tolerance response training, and then they do the tolerance response training again, and then it continues on to this next graph, which is instructional fading, where the teacher starts to no, the therapist starts to fade in their instructions, like schoolwork is starting to get faded in. And then this is maintenance, skill maintenance, and then this is staff implementation. That's when school staff implements the intervention, and they do it first at a separate classroom, and then they do it at the regular classroom. Okay, and the first row here is the precursor behavior, or the problem behavior, the frequency of that per minute. You can see that it was in an elevated state in baseline conditions, and then it stayed pretty low. They said that there were a couple spikes, which I thought was interesting. I believe it's one here and then one, I think one here and one here, where the teacher implemented punishment for the child leaving, although that was part of the intervention package, that the child can just leave and that is okay. And then also this is the simple FCR that is emitted. Functional communication response that is emitted, and you can see that it is in inverse results with the precursor behavior, as we would expect. And then this is the intermediate FCR, and he is acquiring it and he is using it throughout the time. And then this is the terminal FCR. We can see that it is he's starting to use it quite a bit as the study goes on. And then the tolerance response, we can see that the child has acquired it over here, and the rate continued to be quite high. And although you can see that it is declining by the time the teacher is trying to implement it, but we still see that the student is using it. And then cooperation is, you can see that during instructional fading, the child starts to cooperate quite a bit. And then this is session time. If you can see, the black is child-led time, white is adult-led time, and gray is time and hangout, and then the dotted boxes are when the child decided to just leave. And we can see that adult-led time is, increased quite a bit, towards the end, which is exactly what we want to see. Any questions?
Thank you. That was very clear and such a thorough study. A lot of
I
data.
know. I'm so proud of Joey. I had like chills because I know this person, Joey, and for her to have the guts to do it in a public school, and it was just so hard to get IRB in Nashville public schools, and so just so proud of her, right? Such a great study. Anyway, I'm totally biased, right? Because she was my favorite professor. All right, so I'll try to go a little bit quicker for the rest of the kiddos, since you guys are more familiar anyway with the study. I believe I made a mistake here. Oopsie. There you go. All right. So for Theo, his precursor behavior at baseline was also elevated, and emitted no functional communication response at all. And he chose to have more child-led time. As for the simple FCT, he had no precursor or challenging behavior at all, which is what we want to see, right? And then for functional communication training, he starts to emit it at a stable rate. And at the intermediate and terminal FCT stage, still no precursor behavior, which is really nice. And then functional communication response, it was acquired at a stable rate. Sorry, I believe this is the tolerance response. So sorry. Okay, there you go. And then for the tolerance training, we see that he starts to emit cooperation response, which is great. And then at instructional fading, he cooperates, and this is increased, and the pattern is repeated when the instruction is faded in. And he starts to have more adult-led time, which is really great as well. And in the classroom, he maintained cooperation. And this child, he chose to be in practice time 88% of 100% of the time he was in the study. And then he only chose to leave the classroom 12% of the time. And then he never choose to be in the hangout context. So I'll give you all 1 minute to look at the graph. I believe that since I've given you I've oriented you all with the previous participant. This should be self-explanatory, or would you guys rather have me go over it?
No, it's all right. We can look through it, I think.
So I will leave this up for a minute.
I have a question.
Yeah, go ahead.
So for this kid, the total amount of time, if you see the last graph, is it that the total amount of time that he's having the session is getting lower though, is it?
Yeah. And you know that this is when yeah, yep. And I believe this is when let's see. I know that, okay, staff implementer, right? Yep. So this is when the school starts to implement the intervention. And yep, and I see that it is getting lower, and that is also the challenge that we all face, right? When we have to train teachers who have to implement it, and they don't have particular training in ABA. Yeah, yeah.
Oh, okay.
For sure, for sure.
Thank you. So the right side part is done by the teachers and the left one is by the therapists, is it?
Well, here, SI, when you look at SI, that is the staff implementer. So teacher is implementing it, people at the school is implementing it.
Oh, okay.
And
So after that,
all through, yep.
oh, okay.
Yep. And yeah, all through here. I think SM is skill maintenance, but so it's still done by Joey's graduate students, I guess. And so and then after that, it was done by the staff implementer. Okay.
Yep.
Okay. And so Kendrick here also has an elevated precursor challenging behavior, and then did not have any functional communication response at all, and chose mostly child-led time. And then the simple FCT show that it has precursor behavior has ceased. Oh, I'm missing an E. I'm so sorry. Has ceased here, and then FCR, it was emitted at a stable rate, and then intermediate at and terminal FCT. It has a low challenging behavior, but it's increasing. And FCR is acquired, but at a stable rate. Tolerance training varied, but low. And the tolerance response was acquired, and it was stable. Instructional fading is varied but low. The child starts to cooperate, and by cooperating, I mean he starts to do whatever demand that was asked of him within 10 seconds. And he starts to have more adult-led time. And the classroom, in the classroom setting, he had no precursor challenging behavior. And for a functional communication response, he maintained it. And he spent 95% of his time in practice. Only 3% he eloped, and the last 2% he chose to be in the hangout context. And so I will leave another 1 minute for you all to look at the graph. Let me just Okay, any questions?
No.
Okay, all right. All right, let me just move this back. Okay, so discussion. The discussion section talked about with ECM SBT, participants acquired the necessary skills. So we see that the participants acquired the skill to do functional communication responses from a simple one to the terminal one. And then also they learned to tolerate and then also cooperate. With ECM SBT, there was low to none precursor or challenging behavior while doing so, which is really important because I think the older the kids, the less that we want to do any physical prompting, physical blocking, because it could very, very quickly escalate into even heightened aggression and, restraining practices from us. It's really scary and we don't want to do. And then they showed preference for the practice context, but slight increase when response requirement is increased. So it's important that differential reinforcement across response alternative to support allocation to practice context, rate, quality, immediacy, and response effort. So if I'm not mistaken, so this is a big study and it's rather complicated. And so if I'm not mistaken, so what they do in the Hangout context, they still have, low preferred reinforcers. If they're in that Hangout context, then no more demand will be placed on them. However, when they are out of it, then they have to participate in some demands. And then when they are done with the demands, then they get highly preferred reinforcer, and they vary in terms of rate, quality, immediacy, and response effort. Okay, and then for us to discuss, do you all have experience working with children with emotional and behavioral disorders? Oh, wait, are we still on? Okay.
Okay. Yes, I think I'm gonna assume a lot of us have worked with children with emotional and behavioral disorders, and I feel like these children, especially those that are vocal verbal, when they present
So I could not hear anything that Kania said. Was it just me? I wonder if that's my computer. Amna,
No, I couldn't hear you either. It was very, very choppy.
Yeah,
me too. That's
why
why
I turned my other phone. There it goes.
Oh, it's the same problem again.
Okay, I'm gonna try to turn off my video, and I don't know how to do that. Oh, here it is. Okay, all right. Hopefully that will help.
Tanya, can you repeat?
Oh, yes. I said, yes, I do have experience working with children with emotional and behavioral disorders. And I feel like these type of clients who present with this are the hardest types to work with. emotionally for us, especially when there's a team working with these clients, because you have to keep the morale up in the team, and that's really hard with these type of clients.
Mhm.
Yeah, and what are everybody, your experiences, and Amna?
I had similar experiences also. But I was wondering about the clients. I think the requirement for them being included in the study was the three clients were verbal, vocal. And this is up for discussion. I'm not sure. But for the SBT treatment, is that a requirement? Like, would it not really be effective or work with children who are nonverbal?
I think perhaps obviously it'll work, right? You can present a break card, right? And that has been researched really well. I think what they're trying to do is to address those children. There are a lot of them, especially Black and Brown students in the U.S. Who has undiagnosed language disorders, LD. I believe it's language disorder, linguistic. I don't know. I can't believe I can't quote myself right, but and there is a very high percentage, and because they find school so difficult and they don't have the social skills as well as the communication skills to do that, then they engage in challenging behavior to escape the school environment, right? And so I think part of the purpose of this study is to address that population, and probably that is quite different
okay, that makes sense.
it's probably quite different from clinic-based practices that we are maybe more used to, younger kids with autism who are not verbal. And so I hope that,
these are the types of clients I usually work with. And I think we discussed this in one of the previous sessions. I don't know if you were with us or not, but I was saying how I did try the SBT treatment with a couple of my clients before, and it was more effective with the verbal clients, but not the other child who was nonverbal. Like, I saw better results with the child who was able to vocally communicate, but the outcomes were not. I was not successful in implementing it with the nonverbal child.
Yeah, because you need quite a bit of verbal behavior, right, to understand the contingency. You can stay here and get all these wonderful things, and that's part of the things that they do. Actually, they make sure that the child understands and checked for understanding. And then they role play it in the classroom. If you're here, then we won't make you do stuff, and if you leave, you can leave, no problem. And if you're here, then you do a little bit of work with me, and then we can, get all this wonderful reinforcers that they have identified using the ISCA. Oh, I forgot to mention that they did use the ISCA to make sure that they have functionally addressed the challenging behavior.
That's amazing. Like, having the client's consent, like they are there willingly, they want to participate in their learning. That is excellent.
I believe the study takes 8 months though. So and you see, and the for one kid, there is 2 graphs, right, to be able to capture the entire timeline. And so there's a lot of limitation to the study, and part of it is that it takes time to really implement it to fidelity, and to have the child choose and gain their trust, right? But that is what is the alternative to that, though. What are you going to do, restrain the child? Yeah.